If you are like so many people here in the Valley, your allergies are making you miserable right now, especially when you hear me talk about the winds. But there is hope. Heidi has more on what you need to pack in your allergy survival kit.
I'm Heidi GOITIA at the McDowell Sonoran Preserve up in Scottsdale, where a lot of people are heading these days for a hike because the weather is gorgeous. But if you have allergies, it's probably one of the most miserable places to be. Dr. Angela DeRosa is joining us this morning, and you have some things people should include in their survival kit, so to speak, if they're an allergy sufferer.
So we think about water, we think about making sure we have adequate food supply in case we get stuck out there, but you also need to take very good caution when it comes to allergies, because allergies, although may be annoying, they can also become life-threatening over time.
All right, so let's start over here. What do you have here that people should take?
So you want to keep a nice kit with you. So cortisone, which is a nice topical in case you get a rash from poison ivy or even just from straight up allergies from touching something and being in the air, that can help take down the inflammation. You also have a Nasacort allergy spray, which can go into the nostrils. That can actually prevent allergies from going into the lung system and causing trouble.
So is that something you should do before you even head out, maybe?
That's absolutely. These are more preventative because the steroids are not going to work as quickly as, say, some of the other things. So this actually knocks back inflammation before it even starts. Allergy eye drops, because as our eyes start to water from the allergy stimulation, that can help take down the redness and also the itchiness. So that's a great product to keep with you. But if you're really a true allergy sufferer already going into the park with allergies, you may want to consider an antihistamine or a decongestant. And the big difference between the two, antihistamines do just that. They block histamines, which is the allergic response that the body has when we're given allergies into our body.
Okay.
That's what causes the runny eyes, the watery nose, the itching. The decongestant, on the other hand, actually prevents the nasal swelling and also the sinus passage blocking, so it decongests or opens up your passageways.
Can you take them at the same time, same
Absolutely,
day?
you can. And they work together. The decongestants can be a little drying, and so be cautious when you're taking those, especially if you're hiking, to hydrate really, really well.
Okay.
Certain antihistamines, in particular the Benadryls, can be sedating. So there are other ones that are not, that can have much less
Right.
sedation.
A lot of people say, take a Benadryl before bed maybe because it's going to make you tired.
But if you're getting ready to hike, not necessarily the best choice. There are other ones out there that can be much better.
Okay, now this is if you have more of a severe situation going on.
Exactly. So if you have a severe allergy of any sort, you should always wear a medical band in case you go down in the field. The paramedics or EMT can always identify what's going on. You have inhalers, which can actually open up airway passages to help you breathe, which is a very important thing in life. And then last but not least, the EpiPen. If you're a severe allergy sufferer, say from bee stings, or you get problems where you can't breathe, make sure you always carry an EpiPen, because that could be the difference between life and death and getting enough time to get you to a hospital in case something bad happens.
Scary to even think about. Really quickly on the eye drops, can you overuse those? Is there any?
It's really hard to overuse eye drops. Certainly knock yourself out on those, but you want to avoid the Afrins again and make sure you're not using those in detail. But always follow instructions and talk to your doctors if they're really severe.
Good stuff. Dr. DeRosa, thank you so much. We're going to put this information for you on our hotline. In the meantime, we'll send it back to you guys.